this video, we will delve into the journey that has shaped pharmacy-based vaccination across 7 countries. We will highlight key milestones and explore how policies have evolved over time to empower pharmacists in vaccine administration. First, let us take you through the remarkable journey of pharmacy-based vaccination in Australia. The journey began in 2013 when the Pharmacy Board of Australia announced that vaccine administration would be included in pharmacy's scope of practice. In 2014, Queensland launched the pharmacist immunisation pilot, and Western Australia allowed pharmacists to administer influenza vaccines. By 2015, the Queensland pilot expanded into Phase 2, with more states following suit and establishing training and practice standards to prepare pharmacists for this role. Between 2016 and 2020, more states expanded vaccination formularies. Victoria became the first state to offer government-funded vaccinations through community pharmacies. In 2021, pharmacists were authorized to administer COVID-19 vaccines during the pandemic. The following year, free flu vaccine programs were launched, and additional vaccines were added to pharmacy formularies. In 2023, the minimum age to receive flu vaccinations at pharmacies was lowered to 5, with federal funding for National Immunization Program vaccines announced for 2024. More recently, in 2024, the National Immunization Program Vaccinations in Pharmacy or NIPVIP program has been expanded. Starting Monday, 29 April 2024, NIP vaccinations can be administered off-site in residential aged care and disability homes as part of the NIPVIP program. To better understand Australia's journey to vaccination, let's hear from the Pharmaceutical Society of Australia.
Australia's journey of vaccination has really accelerated over the last 10 years, from the first vaccine in about 2014 to now pharmacists being a significant vaccinator as the Australian workforce. Pharmacists particularly provide capacity for surge campaigns such as COVID-19 and influenza and increasingly routine vaccination.
Let's delve into the evolution of pharmacy-based vaccination in Canada. Canada's journey began in 2007 in Alberta, where pharmacists were authorized to administer the flu vaccine and other vaccines. Notably, only those with advanced prescribing authority could prescribe publicly funded vaccines beyond the flu. Following Alberta's lead, provinces such as New Brunswick, British Columbia, Ontario, Nova Scotia, Manitoba, Prince Edward Island, Newfoundland and Labrador, and Saskatchewan granted pharmacists the authority to administer flu and other vaccines. In 2020, Quebec's National Assembly passed Bill 31 allowing pharmacists to prescribe and administer vaccines, including influenza. As of 2023, pharmacists across Canada are authorized to administer publicly funded vaccines without a prescription covering influenza, COVID-19, and routine immunizations. Health Canada also approved the RSV vaccines for individuals aged 60 and older, which is now available in pharmacies. Next, let's take a look at France. France took its first steps towards pharmacy-based vaccination by authorizing a pilot program for flu vaccinations in community pharmacies. The pilot program was conducted in 2 regions in 2017 and was expanded in 2018 to include 2 additional regions, bringing the total to 4 regions. This led to the nationwide expansion of flu vaccinations in 2019, establishing vaccination as a permanent role for pharmacists across the country. During the pandemic, France expanded this role to include pharmacy students and technicians as part of the vaccine rollout in 2021. In April 2022, France authorized pharmacists to administer non-live vaccines for adults and minors aged 16 and above. By November 2022, Over 20,000 pharmacists were participating in the flu vaccination campaign, with pharmacists delivering nearly 48% of all flu vaccines in the country. In January 2023, a new law allowed pharmacists to both administer and prescribe vaccines. This came into effect in August 2023, with pharmacists now authorized to administer and prescribe all non-live vaccines to individuals aged 11 and over. To better understand the journey to vaccination in France, let's hear from the French Chamber of Pharmacists.
The whole journey started back in 2016, actually at the FIP Buenos Aires. We were facing a situation in France with a too low coverage of flu vaccination, especially for elderly persons. So basically we gathered the data of all other countries vaccinating already for flu, and we went to the government saying, hey, we need to do something about flu coverage, and we can do this, pharmacists, and let's put a pilot first and see how it goes. So we all started with a pilot for just flu vaccination, only in 2 regions in France. And then the success was here, and then the pilot was extended to 2 other regions, 4 regions, and the following year it came into the law that all pharmacists could vaccinate against flu. So that was back in 2019. And then the pandemic arrived, and the authorities has decided to use the pharmacists to administer the COVID vaccine to the population. And it was an amazing success since pharmacists eventually has vaccinated more than half of the population with the COVID.
Let's move now to Ireland and explore how the role of pharmacists in vaccination has evolved over the years. The journey toward pharmacy-based vaccination began in 2009 when pharmacists were trained to vaccinate against the H1N1 influenza outbreak. However, they were not called upon as the outbreak proved to be less severe than anticipated. It was not until 2011 that pharmacists in Ireland received legal authorization to supply and administer flu vaccines without a prescription. Since then, over 1.5 million patients have been vaccinated at a pharmacy. By 2015, the range of vaccines offered by pharmacists was expanded to include pneumococcal and shingles vaccines. In response to the pandemic, legislation in 2020 allowed pharmacists to administer COVID-19 vaccines and to provide both flu and COVID-19 vaccinations in more flexible locations such as workplaces, homes, and other sites outside pharmacy premises. In 2024, pharmacists are authorized to administer vaccines against the Omicron JN.1 variant of COVID-19 as part of the National Autumn-Winter Vaccination Program. Additionally, the 2024-2025 season is introducing a new initiative that expands the free live attenuated influenza vaccine or LAIV nasal spray to primary school children. Now, let's turn our attention to Portugal. Portugal's journey began in 2007 when legislation allowed pharmacists to administer vaccines beyond those in the National Vaccination Plan. This was followed by the launch of a training program in 2008 developed by the National Association of Pharmacists to support the national flu vaccination campaign. A key development came in 2009 when pharmacists participated in the first vaccination campaign against human papillomavirus or HPV and further expanded their efforts with campaigns targeting influenza and pneumococcal diseases from 2010 to 2012. By 2013, the training program for pharmacists was certified, officially recognizing vaccination and the administration of injectable medicines as part of their professional competency. In 2016, an agreement between the National Association of Pharmacists and the Ministries of Health and Finance further integrated pharmacies into public health interventions, specifically flu vaccinations. Just a year later, in 2017, flu vaccinations administered in pharmacies were linked to the National Health System's electronic vaccinations records. Between 2018 and 2019, a successful pilot project was introduced in the municipality of Loures in the region of Lisbon, offering free flu vaccinations without the need for prescriptions, which led to a 32% increase in vaccine uptake. In 2023, Portugal expanded its national vaccination campaign in collaboration with the NHS, promoting the co-administration of flu and COVID-19 vaccines. From 2024 to 2025, collaboration with the NHS continues, promoting co-administration of flu and COVID-19 vaccines. No prescription is needed. Individuals aged 60 and older only need to present an ID. Let's hear about Portugal's journey to vaccination from the National Association of Pharmacies.
In Portugal, we have been administering more than 20 vaccines in community pharmacies since 2007, and specifically in 2023-2024, we integrated the national strategy for COVID and flu vaccination, which allowed community pharmacies to contribute to the overall coverage that we had for the Portuguese population. We administered around 70% of all vaccines for flu and COVID at the national level, which allowed us to exceed or maintain the flu coverage that we had from previous years, and also have a COVID-19 coverage in Portugal that exceeded 5 times the European average.
Let's delve into the evolution of pharmacy-based vaccination in the United Kingdom. In 2010, pharmacies in England began providing local-level flu vaccinations. By 2012-2013, all pharmacies were invited to participate in flu vaccination campaigns, and 11% of pharmacies in Wales took part. During the 2014-2015 season, flu vaccination was offered in pharmacies in England, mainly in London. Prior to this, most pharmacies offered flu vaccination as a private service. A significant leap occurred in 2015-2016 when flu vaccination became a national service in England, allowing patients to access vaccinations in any pharmacy without needing an appointment. This led to a notable increase in uptake, and by 2017-2018, pharmacies across the UK were delivering a larger share of flu vaccines. In Wales, for example, 60% of pharmacies administered 4.5% of all flu vaccines. The role of pharmacies expanded dramatically during the COVID-19 pandemic. In 2021, community pharmacies in England, Scotland, Wales, and Northern Ireland began administering COVID-19 vaccines, with over 400 pharmacies in England alone giving 1.7 million doses. This effort grew further in 2022 when more than 22 million vaccinations were administered at community pharmacy-led sites, with a 50% increase in pharmacies offering boosters. In 2024, pharmacies in the UK played a key role in the spring 2024 seasonal campaign offering COVID-19 vaccines. Pharmacies are also authorized to provide RSV vaccines to pregnant women and older adults. Let's now explore the United States. The journey began in 1994 when pharmacists in Seattle were first trained to administer vaccines. By 1996, the American Pharmacists Association, or APA, adopted a policy encouraging pharmacists to serve as educators and administrators of vaccines, leading to the training of over 340,000 pharmacists. By 1998, 14 states had authorized pharmacists to administer influenza vaccines. And by the early 2000s, pharmacists were taking leadership roles in immunization coalitions. In 2007, pharmacists were recognized as first responders in emergencies. A significant milestone occurred in 2009 when all 50 states legally authorized pharmacists to provide vaccinations. In 2013, APA introduced the term immunization neighborhood to promote collaboration among stakeholders. By 2016, immunization training became a requirement in all SCP-accredited pharmacy schools. The COVID-19 pandemic brought rapid changes, with the Department of Health and Human Services authorizing pharmacists, technicians, and interns to administer childhood and COVID-19 vaccines in 2020. More recently, in 2023, the Department of Health and Human Services authorized pharmacists and pharmacy technicians to administer COVID-19 and seasonal influenza vaccines for individuals aged 3 and older, as well as COVID-19 tests until December 2024. And that concludes our exploration of the journey toward achieving pharmacy-based vaccination across 7 countries. The FIP Pharmacy-Based Vaccination Surveillance Atlas is an open-access interactive tool providing detailed data on pharmacy-based vaccination services around the world. You can explore country profiles, summaries, maps, and graphs based on FIP member contributions.